Hey everyone, Dr. K here from Essential Health and Wellness. With the season going up and down, warm weather, cold weather, pressure changes are coming into play. A lot of people are complaining of headaches. So we're going to talk about headaches and what we can do to help you with these complaints. Most headaches are not a cause of life-threatening diseases. So majority of the headaches fall into one of three categories: your tension, your migraine, and your cluster headaches. With these three types of headaches, there is some overlap, but there are some key symptoms that can help us identify which headache you are experiencing. All right, so the first type of headache that we're going to talk about is the tension headache. So common symptoms that people feel with these is pressure on both sides of the neck or the head. Radiation from these muscles and these pressure points can come from the neck and come around the ear, into the eye, front of the head, and kind of mimic like a sinus type headache. Second symptom that they feel is more of a mild to moderate pain that is steady, so it does not throb like a migraine may. These tension headaches do not worsen with activity, and the severity can increase or decrease over the course of the headache. Lastly, like I said before, they typically feel these tender points around the head or neck, trigger points. When we dig in there and get our hands on them and really work on that muscle, a lot of times they do get a referral when we're working on that muscle. That just tells us that we're in the right spot and that's the area that we need to treat. With tension headaches, these people do not experience symptoms where a migraine might have. So nausea, vomiting, sensitivity to light or sound. That's going to be more of your migraine headache, not your tension type. So we talked about tension headaches, and now we're going to show you how we treat them here in the office. I'm just going to show with what I do. Me and Dr. Schaefer, what we do in our offices. We also offer, obviously, massage therapy, which is tremendous for tension type headaches. So when a person comes in my office initially, I like to assess the muscles because that is where a lot of tension headaches come from. And I start where the most common ones are, more the upper cervical or the upper neck. The easiest one to examine right away is called the SCM. And that muscle is in your neck, right along here, and attaches to this bone back here. So I talk to the patient throughout the whole thing. If I press anywhere on a trigger point and it refers that headache, just let me know, okay? And I just feel around. Feel that attachment point, turn your head, lift up, good. Find that muscle, any pressure in there, good. And now we just go through all of our muscles in the upper cervical. So the suboccipital triangle are the most common muscles to refer headaches. And all of them attach to the occipital, so back of the skull, and down to C1 and C2. So I like to assess along the skull, right back here. This is tender on a lot of people. How does that feel?
That's tender.
Tender?
Mm-hmm.
So depending on what muscle I'm working with, so right here, so more on that spot, that's going to be rectus capitis posterior minor. And what that muscle does is a lot of extension. So if I want to work on that muscle and stretch it out, I like to pin that, do a chin tuck for me. Good. And just pull up. That's going to stretch out that muscle, work on that trigger point. So tuck again and pull. Good. To further deepen that trigger point therapy, do a chin tuck, and now press the back of your head back down into the table. Good. Press, 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 press. Good. This is very sensitive on people. So I know I'm putting you through some work, huh? So that's going to be one muscle. The other muscle is your the superior oblique. So that's going to be coming right around C2. Any tenderness right there?
Mm-hmm.
Yeah. And to work on that muscle, it does a little bit of extension and rotation. So I like to do a chin tuck and rotate them through, just like that. Chin tuck and rotate. Good. One more and rotate. Good. Your inferior oblique is going to be more of a rotational. So as we're doing that, that's going to be a little bit more on the outer side, lateral, and same thing. So we shorten it, lengthen it, and I might even add a chin tuck, just like that. Good. Rotate, chin tuck, just like that. Cool. So that is going to be majority of muscle work for the upper neck. And I can go down to your splenius capitis. It's a big, broad muscle right on the side. And we just work on that muscle. Once you get to here, work on it up and down, try and find those trigger points and work on those. But for now, we're going to leave it at that, and we're going to flip on over to our stomach. All right, so commonly we do a lot of dry needling for tension type headaches. This works very effectively for these type of headaches. Reduces a lot of tension in these muscles. So as we just described, a lot of these suboccipital muscles attaches to the base of the skull and down to around C1 and C2. So that's where we do a lot of our needling. We also do some needling into rhomboid areas if we can find some trigger points in there. Today we're only going to be focusing on the upper neck. So I already cleaned it off with some alcohol swabs. Grab our needles. So the first one I like to go for is splenius capitis. So that's right off of that mastoid process. Good. How are we doing? Good. How's that feel?
Very good, yeah.
Perfect. So I tell a lot of people you can feel one of three things, or a combination of these three. Either nothing at all, a slight pinch, or a what's called a muscle twitch, where the muscle quickly twitches and then it relaxes. As we twist this needle, we wind up that muscle tissue around that needle, and that further progresses the effects from needling. So we can go further on down the neck. Get a little pinch with that one.
A little twinge, yeah.
Good. How does it feel right now?
It feels good.
Good. Yeah. So that is going for more of a cervical extensors and stabilizers. These muscles get very tight in tension type headaches. So attacking those muscles right at the source with dry needling is going to help those relax quickly and effectively. This cuts down treatment times and cuts the cost of treatments, because now you're not going to be having to come in multiple times a week, every week. So we look for the most effective types of care, and that's how we go. So we're going to hit one more. So another common one is people's traps. Nope, you can leave them wherever you want. So pinch that trap muscle. Get a needle in there. How does that feel?
Mm-hmm. It's good.
Good. Feel it?
Yep.
Good. So we wind up that needle, and you'll feel a nice tension pull right on that. So that is dry needling for tension type headaches. All right, so we did some muscle work for the neck, and we did some dry needling to further loosen the muscles up. Now we can get into more of an adjustment. So again, mid-back is usually tight on a lot of people, working desk jobs, anything like that. And that can also refer pain into this neck. So just assess mid-back, very stiff on Miss April here. Good, breathe out. Good, good. And then we can also get her upper thoracic and lower neck right from this spot. Good. Breathe out. Good. Perfect. And then let's flip on over to your back. How are we doing so far?
Doing good.
Good. So the way I like to adjust upper cervical and C1, C2, there's two ways that we commonly do it. So we can either turn them all the way over, turn to the left, keep turning. There you go, good. And I can hook them on the bottom and do a lift, just like that. My preferred way, contact that C1 at the top. Look down for me. Look up. Look down. Relax that. Look up. There it is. Feeling all right? Good. And then over here, we can either do the same thing. Look down. Look up. There's that. And we can assess the middle of the neck as well. That's fine. That's fine. Good. So that's pretty much the treatment for tension type headaches.